Welcome to the Brain Health Podcast, where we discuss cutting-edge science to help you maximize your brain function while aiming to slow, stop, and even reverse symptoms of cognitive decline. I'm your host, Dr. Jonah Yakel. Hey, thanks for tuning in today. We are going to be diving in and talking about the carnivore diet today. This seems to be all the rage right now. I've never quite had so many people coming to me and showing up for their first visit, and they're actually already integrating a carnivore diet into their lifestyle as part of their healing and recovery. So I thought now would be a great time to have this conversation. And I will say right off the bat, this is hands down one of the most powerful tools that I've incorporated into my own practice. I've been doing it in my own life for on and off for the last probably 3 years, and it was truly a game changer. And so for those of you who just listened to my last podcast, which was talking about the ketogenic diet, I'd like to draw some parallels and some differences. And the truth is that a ketogenic diet, and like I said in the last podcast, I don't really like thinking of the ketogenic diet as a diet per se. I mean, the ketogenic diet is very much based off of chemistry. So it's really determining on what is our body burning and utilizing for fuel. Our body can use either glucose or carbohydrates for fuel, or our body can use fat for fuel. And as we discussed in depth in the last podcast, it's like, our bodies historically evolved burning fat for fuel, but over the last 100 years, maybe even 200 years or so, we've really changed that as we've become much more prone to eating a high carb diet. And that's really how most people eat at this point, especially, in the United States. It's a high carb diet. It tends to also be a high fat diet. And this is just a recipe for disaster when you're combining both carbohydrates and unhealthy fats. I don't know that you could make up a more detrimental diet in regards to things like inflammation and blood sugar and brain health. But ultimately, ketogenic diet is, in absence of carbohydrates, our body is forced to start utilizing fat for fuel. And as I mentioned, that is likely how our bodies evolved, burning fat for fuel. It's highly efficient, it's very anti-inflammatory, and it's been shown consistently to be the optimal diet for brain health. So carnivore, on the other hand, or in addition to, is actually a ketogenic diet. It is a form of a ketogenic diet because, again, we are in absence of high amounts of carbohydrates. So they're actually mutually exclusive. If you are doing a carnivore diet, you are most likely going to be in ketosis, or absolutely you're going to be in ketosis. So it's not, well, should I do a ketogenic diet? Should I do a carnivore diet? Should I do a paleo diet? Should I do an AIP diet? Well, whichever one of those diets somebody chooses, in all cases, we want to make sure that the person is getting into a ketogenic state. So all of them can be ketogenic, and that is certainly true of a carnivore diet. So a carnivore diet is inherently a ketogenic diet. Now, what makes it different from, say, a classic ketogenic diet? Because on a keto diet, you can eat, high amounts of animal proteins. You're certainly eating lots of fats, but you're allowed to eat a fair number of different vegetables as well. And, some people on what might be considered a more dirty ketogenic diet will integrate things like dairy and whatnot. But what makes a carnivore diet specifically different is it's eliminating all of those other things. So no vegetables, no fruits. Some would say no dairy. Some are okay with doing dairy. And I'm going to wrap back around to that in a minute. But let's talk just briefly about the philosophy. We've all been taught that meat is inherently bad for us. And this is certainly true of anybody who's gone to any kind of medical school. For the most part, it's like red meat causes cancer, red meat causes high blood pressure, red meat causes inflammation, and all of these other things, gout, like you name it. But what the current science is telling us is that that's absolutely not true. And in fact, it's very much been given a bad name, and that these animal proteins, when they're coming from healthy sources, are in fact can be very anti-inflammatory as opposed to inflammatory. So when I first came across this many years ago, I had a resistance, because it's like, certainly, how could this possibly be healthy? We know that vegetables are packed with nutrients. They're packed with antioxidants. They're packed with all of these phytonutrients that are, good for inflammation. It's good for our brain. It's good for our heart. It's good for everything. Whereas, we've been mostly taught to eat meat very minimally and reduce that, and to focus more on fruits and vegetables. So how could it suddenly be that eating a diet that is inherently all fat, or all animal protein, I should say, how could that possibly be healthy for us? Well, when we start diving into the philosophy, it makes a lot more sense. And it has a lot to do with evolution, and it has a lot to do with survival. And that animals inherently, just like humans, we're animals, that we develop fight or flight systems. Like, this is how we protect ourselves when we are under stress, when our survival is at stake. We kick into a fight or flight state in our nervous system, which allows us to either fight, whatever our opponent is, or we can flight, we can run away from it. Whereas plants, on the other hand, they don't have that option. So they can't fight or flight, but plants also want to survive. They also want to thrive. They also want to proliferate and spread across the earth. They don't want to necessarily be killed either, but because they can't fight, because they can't flight, over thousands and really millions of years of evolution, they have also developed what is called defensins. So plants inherently have specific toxins in them that prevent, or maybe I should say, it discourages animals from eating these plants. And some of those defensins include things like oxalates. Maybe you're familiar with oxalates, and things like lectins. But essentially, when eaten in high amounts, now again, a lot of these vegetables can be very, very high in nutrients, although it turns out that none of them are as nutrient dense as animal protein. But nonetheless, they certainly can be high in certain nutrients, but they come at a cost, because we're also introducing specific toxins. And at high enough dosages, in combination with all of the other stressors of today's lifestyle. So when you just talk about our day-to-day stressors, all of us have most likely been on antibiotics at some point or another, which has oftentimes destroyed a lot of the bacteria, the good bacteria in the gut. A lot of people eat high inflammatory diets. People drink alcohol. You can enter in like non-steroidal anti-inflammatories, but we do a lot of things in our day-to-day life, not to mention also environmental toxicity, like exposures to things like glyphosate on our vegetables and in our foods, herbicides, pesticides. But over years, this all starts to inflame and damage the gut, and it makes us more vulnerable. And so when we start consuming these vegetables, these vegetable defensins, on top of having a gut that's already inflamed, it can trigger all kinds of additional inflammatory issues. So you might be able to argue that in low dosages, in a environment where our gut is actually quite healthy, that we can tolerate fairly, we can tolerate vegetables. However, a lot of people who come to see me are very, very chronically ill. And in fact, these are the folks that a carnivore diet seems to have made the biggest difference for. So when people show up into my office and we're dealing with autoimmune conditions, for instance, or maybe we're dealing with severe mold toxicity or Lyme disease or even long COVID, and in these cases, there's so much overflowing inflammation already going on in the body, that taking vegetables out of the diet, removing those defensins, takes an enormous load off the body and allows the gut the possibility to actually start to heal and recover. So in a lot of ways, I think of the carnivore diet as just being an incredibly intensive elimination diet. So different people do it for different lengths. A lot of times I'll just recommend someone do it, for 7 to 10 days and just kind of see how their body would react to it. Although I will say there are some challenges to doing that, because sometimes in the first week or two, our body might not react in the greatest way. It will stimulate detoxification processes. Our electrolytes will be thrown off. So for a lot of people, the first couple of days are actually can be quite challenging, and you might actually feel worse. But after you hit about that 10-day to 2-week mark is usually when people start noticing a fairly radical improvement in their overall health and well-being. But I'll encourage people. It's like, try it for a couple of weeks, try it for a month. I've had people who do it for a month. I've had people do it for 6 months. I've had people who heal and recover and feel so great they continue to maintain and stay on a carnivore diet. But so think of it as an elimination diet. Now, this is something that most functional medicine doctors have been using for years and years and years, and quite frankly, for decades. It's like when people show up, we can develop food sensitivities, food intolerances. So one of the ways that we'll treat chronic illnesses is removing the most common food sensitivities, or the most common foods that are likely to inflame people. And this led us oftentimes to doing what's called an AIP, or an autoimmune protocol, also known as an anti-inflammatory protocol. But it's taking out those foods that are going to be most likely to trigger in an inflammatory response. So, this is namely going to be things like wheat and grains. So, of course, gluten, dairy, corn, soy, eggs for a lot of people, although those are allowed on carnivore. Those are kind of the biggies. It's like, if you take out most grains, and of course any kind of processed foods and sugars, take out dairy, oftentimes people would get radical changes in their health. But what I learned over time doing this is that sometimes it still wasn't enough. So we would run food sensitivity tests, only to find these food sensitivity tests come back and people had developed food sensitivities to foods that were inherently considered quite good for us. And in fact, I remember the first time that I did my own food sensitivity panel on myself, and by then I was already eating pretty clean. I was eating mostly animal proteins and vegetables, so a lot of salads and fruits, and it was a very paleo based diet. So I was shocked when this food sensitivity panel came back, only to reveal that I had sensitivities to things like romaine lettuce and broccoli and cauliflower. So foods that I was actually eating in high amounts, kale, foods that I was eating in high amounts were actually contributing to my inflammation. Here I was eating these foods in an attempt to reduce inflammation, when in fact all I was doing was generating and stimulating more and more inflammation in my own body. So during this period, it's like, a lot of people started doing food sensitivity testing, but those have their own challenges. One, a good one is actually quite expensive. So, you can easily spend upwards of $1,000 to do it right. I certainly wouldn't splurge for the lowest charging one, because they're going to come back with a lot of false positives. They can come back with false negatives. So they're not perfect. Like, they're good and they can give us guidance, but they're certainly not perfect. So they can be very expensive, and they're not always 100% accurate. So elimination diets was kind of always, it's the most challenging, because we got to take out the foods and then slowly reincorporate them after people are feeling better, to see if we can't pinpoint what food exactly was causing an inflammatory response. The carnivore essentially did away with all of that. So AIP was really just animal proteins, vegetables, and fruits. That was a very strict AIP diet, and quite frankly, a lot of people responded really well. But carnivore has kind of taken that to the next level. It's actually even removed some of the typically accepted vegetables on an AIP diet, and essentially getting all defensins, all oxalates, all lectins out of the diet. So again, it just kind of goes back to the philosophy of carnivore, this idea that, plants have developed toxins, which again is not to say that they're entirely bad for us. It's not to say they don't have nutrients in them, but they do have toxins in them that can develop an inflammatory response within the body. Now, some people on carnivore diets, I'm seeing more and more people leaning towards what would be referred to as a carnivore plus diet, where they will eat animal proteins and they will also eat some fruits. Now, there's a lot of debate as to whether or not that's a true carnivore diet, or if it's actually even all that healthy for us. But The reason that that seems to be acceptable for a lot of people is because the fruit developed by the plant is actually intended to be eaten. And that's really the intelligence of the plant. It's the intelligence of evolution, is that, animals then eat the fruits. And of course, in doing so, they eat the seeds, and then they spread the seeds again across the earth. And, it allows the plants to continue to proliferate and grow and to spread. So the fruit tends to be very, very low in these toxins if it has them at all. So again, it can have high nutrients. The downside to fruit, as you might know, is that it can be very high in sugars, and it can cause glucose spikes for people, which can, be a source of inflammation in and of itself. So carnivore diet in and of its own is just purely animal proteins. And if you want to do it like as strictly as possible, it would be just eating beef. So a day in the life of someone who's doing a carnivore diet, and this is certainly what I've done in the past. And if I don't always focus just on beef, but generally I incorporate a fair amount of intermittent fasting. So I might spend 14 to 16 hours in a fasting state, and then maybe around lunchtime I will eat a couple of burgers, patties. So I'll just cook the patty and salt. So no condiments. No dressings, certainly, of course, no buns, but not even any like lettuce wraps. You're just eating the the ground beef. And then for dinner, I might eat like a sirloin steak, or maybe I eat a ribeye, or maybe I'll eat a New York, or sometimes I'll cook some brisket, or you can even do something like a chuck roast or something like that. So you can get some fattier meats in there, you can get some leaner meats in there. But essentially, I think that right there is the gist. I mean, that is what a carnivore diet and its most strict adherence is going to look like. So what I found over time is that I actually feel best when I'm actually only doing one meal. Like when I really get on a roll, I'll just do maybe one meal a day, oftentimes around 3:30 in the afternoon. I'll do a steak, I'll do some ground beef, and I will feel great. My hunger is very minimal. My energy levels are really great. I love the fact that I'm not thinking about food all day. It just stops consuming my life. I'm not wondering like, what is my next meal going to look like? When am I eating next? What's it going to be? And, it just really simplifies life, and it really opens up my life for a lot of other things that I really love doing that I seem to not always necessarily have a lot of time for. Now, most people, like I said, that's a fairly strict approach. So technically, a carnivore diet is going to allow for anything. So you can eat beef, you can eat chicken, you can eat pork, you can eat fish. Oftentimes you can eat seafood, things like shrimp and whatnot is acceptable on a carnivore diet. And this actually adds in quite a bit of variety. It makes life a lot easier. And I typically like to make my meals where I'll have multiple different meats in one setting. So it's like, maybe I'll have a sirloin steak, and I'll have a chicken breast, and maybe I'll have some pork chop or something like that. So it's like it adds a level of diversity where it can get awfully bland sometimes when you're just eating the same thing for every single meal. So it throws in some diversity. But I'll say that for myself, this was a real game changer for my health. And I mean, this has radically changed the outcomes for people that I'm working with who are struggling with autoimmune conditions and people struggling with chronic inflammatory response syndrome, specifically struggling to recover from mold-related illness, long COVID, Lyme, things of that nature. And I think it's really important to point out that a carnivore diet is not a cure or a treatment for chronic inflammatory response syndrome or mold-related illness. But what it does seem to do is dramatically reduce the inflammatory response that's going on inside the body, in large part because, again, we're removing the immune reaction that is oftentimes occurring from eating foods that we've developed sensitivities to. So it allows people to function, or gives them a higher level of functioning while we take them through a recovery protocol, so they can actually detoxify from the exposures and then shut off the inflammation and then heal the tissues that have been damaged from the ongoing exposure. So there seems to be a huge correlation. A lot of people who are struggling with biotoxin related illnesses are coming across carnivore diet as a great means for managing their symptoms as they're going through recovery. But I also find that a lot of them are plateauing. They're hitting a point where they're just not getting better. They got maybe 80% better and they're just not getting over that hump. And that's where it's important to then incorporate something like a Shoemaker protocol to help complete the healing and recovery. But hands down, if anybody's showing up in my practice nowadays and they're struggling with an autoimmune, the number one tool to help these people shut down that inflammation and to heal and to get their lives back, get their brains back, is incorporating a carnivore diet into their life. So a couple of things worth noting. I think it's really important. I love to watch the science here. So we want to watch labs. Again, a lot of people are very hesitant. It's like, hey, heart disease runs in my family. I couldn't possibly do this. I've consistently found that when people are on a carnivore diet, all their cardiovascular markers improve. Cholesterol tends to go down, triglycerides dramatically go down, inflammation goes down, blood sugar and insulin resistance actually can reverse on a carnivore diet. So all of these major risk factors for cardiovascular disease actually improve when people get on a carnivore diet. But the proof is in the pudding. It's like, I prefer to play it safe and watch, like, let's not guess. So I love it when we can actually run. I highly encourage people to have a comprehensive functional blood panel run before they start carnivore. Just like, what is your starting place? What are your inflammatory markers look like? What does your blood sugar look like? How's cardiovascular health? Also important to watch hormones. Just make sure thyroid's functioning and estrogen, progesterone, testosterone are all at healthy levels. And then run it again. And you could do it as soon as a month or two, or maybe 90 days later. You can rerun the labs. And again, I think this just adds a layer of, one, credibility and validation to the diet that it's actually working. But I think people feel a lot more confident. One, they're going to oftentimes, they feel 100 times better. So, that counts certainly for something. But two, to be able to come back and look at the labs after 90 days of being on a carnivore diet and see for yourself how much your physiology, how much your chemistry has improved, how much your risk factors have actually reduced, whether we're talking about cardiovascular risk or risk for things like Alzheimer's and dementia. We can literally see these things improving, decreasing the risk for chronic disease processes when people have been on it. So one, I think a before and after of being on a carnivore as far as labs go is incredibly important. And then a couple of just troubleshooting tips here, because I can almost guarantee most people are not going to feel good when they first get started on carnivore. Diarrhea is a very common symptom within the first week. A lot of people are going to develop what's oftentimes referred to as a keto flu. So some dizziness, some fatigue, some muscle aches, all of those can happen. Also, the gut is generally not used to eating so much protein and so much fats. So, nausea, indigestion can actually happen. And again, I'm not saying this is going to happen in all cases. I have one woman who's had major chronic GI issues, just bloating, SIBO, irritable bowel syndrome, all of that actually resolved when she got off vegetables and focused entirely on a carnivore diet. So it's not that this is going to wreck the gut or anything. It's just, it can put a little bit of stress on the gut when we're not used to eating such high fats and such high protein. So a couple of just must-dos. If you're planning on giving carnivore a shot, I highly encourage you to work with a doc who's actually done it before, just so you can, see your before and after labs. But also you're going to want to make sure that you incorporate some really good digestive enzymes. Make sure you're eating those every time you're eating your meals, just to help break down the proteins and the fats. That'll help reduce the nausea, that can help reduce the diarrhea. A lot of people also consider constipation to actually be a side effect, but what I have consistently found is that most people don't have as many bowel movements just because they're not consuming as much bulk dietary fiber, and maybe even just taking in less calories. But rarely do I have people who actually feel constipated. They just don't have as many bowel movements, but they feel fine. So they're not getting the bloated, uncomfortable, backed up sensations or feelings that often come when we talk about constipation. So yeah, it would be normal that you start having less bowel movements for a lot of people. But so making sure you're taking digestive enzymes, also really important to be taking a really good electrolyte supplement. This can be done in a couple of different ways. You could just start adding some Celtic sea salt into your water to get extra electrolytes in. But when we start shifting into a ketogenic state, it can create a fairly significant electrolyte dysregulation inside the body, which again will just make us feel really crummy overall. So a lot of the symptoms or the side effects of a carnivore diet that occur during what I consider the adaptation phase, so just the first couple of weeks, can oftentimes be eliminated or at least significantly reduced with some basic digestive enzymes, as well as some electrolytes or a good mineral supplement. So there you have it. Carnivore diet. It is a game changer for people who are really struggling with chronic conditions, autoimmune conditions, chronic inflammatory response syndrome, mold-related illness, Lyme, long COVID. All of those seem to respond really well to people getting off the vegetable defenses and focusing entirely on a carnivore diet.
Thanks for listening to the Brain Health Podcast. If you'd like more cutting-edge information on brain health, you can follow me on Facebook, Instagram, and TikTok, or simply head over to my website, thebrainhealthdoctor.com. If you love the show and want to support us, please leave a 5-star review on Apple, Spotify, or Google. Thanks again for listening, and see you next time.